Good evening. My name is Teresa Jordan, and I'm one of many group members who worked on our research project this semester. And today I am going to be highlighting our PowerPoint and our group work presentation, which together we came up with is Ending Adolescent Addiction and Overdose in Ohio. Our group members are Madison Foreman, Ava Long, Joshua Payne, and Erica Quinn. Together, we researched for months and we came up with our problem statement. As substance abuse continues to rise over the past 10 years, more young adults are experiencing fatal overdoses, highlighting a growing public health crisis that demands our urgent attention. How do we end drug abuse? Drug abuse and overdose deaths in teens are a serious concern with varying trends across many different substances. Who is at risk? The most common age group for drug use and addiction is mid-teens and early 20s. The drug epidemic mortality rate has doubled every 3 years, with the 5th highest rate of overdose deaths. Now let's talk a little bit about drug use history. The early 2000s saw a significant increase in prescription drug abuse, particularly opioid painkillers such as Oxycontin and Vicodin. Many young people became addicted after gaining access to these medications through friends, family, and sometimes illegal sources. Fentanyl and other synthetic opioids has contributed to a sharp increase in overdose deaths. Ohio became a focal point of the broader opioid epidemic. Unauthorized use of prescription medications, which led to a rise in heroin use as a cheaper alternative, especially among teens and young adults. Together, we all came up with different solutions, but first I will go over my top 2 solutions. One was implementing trauma-informed care in schools. Overall, trauma-informed care in schools helps create a nurturing environment that reduces vulnerability to substance abuse by addressing the root causes, trauma and emotional distress. This proactive approach can lead to decreased rates of drug use and healthier developments for teens and young adults. My second solution was expanding on Ohio's Casey's Law. Casey's Law could potentially help teens and young adults avoid becoming drug addicts by providing a legal framework for intervention early. It allows loved ones of family members who are struggling to request court-ordered treatment for individuals. Many people don't recognize they have a problem, and their families see it first. So helping reform this legal framework could help us exponentially. Now, let's talk about our solutions grid. Here we'll discuss the cost, feasibility, time, potential negative consequences, effectiveness, and public acceptance. Now, for cost, I rated it as a 1 because financial burden would be placed on the petitioners and the cost of the taxpayers to revamp these laws. Feasibility, I listed it as a 2. We would need to replace existing laws and change structures. Time, as you know, it takes the courts a very long time to come up with new laws, get them approved, and implement. Negative consequences, I marked as moderate. Because of potential ethical consequences because of involuntary aspects. Effectiveness, I marked as a 4. I think it would be very effective to get those in need the help they deserve. Public acceptance, also moderate. We would need to sway potential voters and lawmakers to make them understand this is a real concern, and there are families that are struggling that need this support and this help. Then my solution grid for trauma-informed care. This was my personal top solution. The cost would be moderate. We already have existing staff. We would just need to train effectively. Feasibility. Also, I marked as a 2 because we do have structures in place. It's not quite moderate, but we would have to bring in outsiders that would train these professionals, which would make it a little bit more difficult. Negative consequences, moderate. There could be some resistance by certain parents because of cultural needs and then privacy concerns. Time. We would have to train all new staff. Moderate. I would mark that as moderate because we could conceivably do that within, I would say, 6 months. Resources available would be a 5. We already have the Department of Education. We have SAMHSA. It would be very effective, so also a 5, because we'd be getting at those root causes of the addiction and have better outcomes. Now, public acceptance would also be a moderate because of, like I said before, privacy and cultural concerns. Now, our group grid. And these are our top solutions together. First, we've got solution 1, expand funding and outreach for programs like LAP. Ava came up with that solution. Then we have solution 2, which would be implementing the trauma-informed care, which was what I came up with. Solution 3 would be increase access to affordable inpatient and outpatient treatments. That was done by Madison. And solution 4, promote youth peer support groups by Erica. Now, out of all of these, the best solution was expand funding and outreach programs like LAP. Now, that one was the most feasible, the most cost effective. We already have the structures in place. Public acceptance is already known. We know that there is community support for that. And then, let's see, we have the reasons why. So the cost is efficient because we have the existing structures. It is feasible because nonprofits like LAP have existing infrastructure and community trust. It is low risk for negative consequences. It can happen quickly. Many nonprofits have resources available and partnerships to draw upon. It is effective because programs like these have a proven track record. Very strong public acceptance. And in conclusion, it was really great to work as a team in this research project. This topic is very near and dear to my heart. I myself have struggled with addiction. I have loved ones who have struggled with addiction and have seen firsthand the devastation that it causes. I know everyone in our group enjoyed working on this project, and we hope in the future we are able to make all of these solutions a reality. Thank you so much.